We're going to cover how to create an EMS page for our report. Earlier in the report, we covered person involved. We created our unknown subject that was unresponsive, unidentifiable, no ID, no one on the scene knew who they were. Well, now we've gotten to the EMS module, and we need to include this person so that we can show what kind of assessment we had and what we did to help them. So here we have a grid and it's currently empty, so we're going to click on the baby new, and then right here in the middle above the yellow boxes there's a choice of global subject or person entity involved. Well, we've already said who it was, so we're going to click person entity involved, and then the screen changes. Now we have a box for their name, and when I click the down arrow, the person we listed earlier is going to be listed there. So I'm going to click on their name. Now at this point we can continue filling out the screen. Our human factors contributing all of this, including provider assessment. It makes the most sense to follow down the columns, G1 to G2 to H3. Down to I, procedures used. Then over here to the next column of J. K will only be available if you had some sort of cardiac up here in your provider assessment. Initial level and highest level are always EMTB. Patient status remain the same. Did they have a pulse on transfer? Yes. And what happened with the patient? Refused. Did they transport with an attendant, or did they just go in the ambulance? They just went in the ambulance, no fire department personnel went, so non-fire department transport, private EMS. At that point, we're going to go to a baby save. And now we've finished that patient. They've added to the grid. If we had more patients, we could click new and continue on with our patients. We're going to click next. And on this page we now have our patient. I'm going to click open, and if they had a body site injury, down here on the bottom I would click baby new. I would give where the injury was at, abdomen, type of injury is a blunt injury, and click save. I could add as many injuries as they had.